Hello, welcome back to our video series on healthcare information technology. We will continue our video course with our video on chapter number 5, Medical Business Operations. Some objectives for this chapter: define frequently used healthcare terms, identify and describe the functions of certain healthcare departments, describe the uses for clinical software, list and describe the steps in the clinical process or environment, and lastly, identify and describe the functions of various medical devices. Now, healthcare is one of the largest industries in the United States, and there are over 14 million workers in this field. The Bureau of Labor Statistics forecasts that there will be 3 million new jobs in healthcare between the years 2008 and 2018. And one of the fastest growing sectors of healthcare is home healthcare services. This is projected to be one of the fastest growing areas until 2018. First, we'll talk about medical terminology. Now, for healthcare, the terminology becomes very specialized and can become very cumbersome if you aren't familiar with some basic terms. And there are large numbers of acronyms that are used, various body parts and body processes. When it comes to imaging, this is often called radiology just in general. And this will use technologies of different kinds to provide visual representation of internal body structures. And this can eliminate the need for a biopsy or surgery in some cases. And some of the major types of imaging technologies that you'll see, of course, the standard X-ray, then the CAT scan, or CT scan, as it's known, fluoroscopy, MRI, magnetic resonance imaging, ultrasound, and nuclear medicine. And a newer form of radiology is called capsule endoscopy. And this is where a patient will swallow a miniaturized camera within a capsule, and that camera will record its journey through the gastrointestinal tract. Alright, now we'll talk about primary care physicians. Now, there are over 20 physician specialties in medicine. And some of these specialties can include a family, or also known general practice. This covers a very broad range of ailments and chronic disorders. Internal medicine, this will address adult diseases and chronic disorders. Pediatrics, this field addresses the diagnosis and treatment of diseases in children. So these are just a few of the very large number of specialties that you can find in healthcare. A term that you'll see common in healthcare is the term stat, and this is derived from the Latin word statum, and it means immediately. So if something is needed incredibly urgently or at that very second, the term that's used is stat. Another term we'll mention is acuity. This is used to measure the degree of patient disease or the patient's injury. This can refer to the severity of the condition, the time sensitivity, the physical effects, or the psychological suffering of the patient. And the higher the acuity means the more injured they are, the more serious the condition is. So someone with a scratch on their skin is a low acuity. Someone with a stab wound is a high acuity. So the higher the acuity is a reference to the seriousness of the condition. The phrase that you'll see in healthcare setting is code blue. This is an emergency code. This indicates that a patient needs immediate help. And it's something that can be announced over a PA system throughout the facility, so people know exactly where to go and what to bring at that very second. Next term we'll talk about are trauma levels. Now, trauma is a physical wound or injury to the body, and this may be caused by violence or by an accident. These are commonly treated at hospital emergency rooms. Now, trauma centers are classified according to their ability to handle different kinds of trauma all at once. And there are 5 levels of trauma centers. And on this table we have a breakdown of the 5 different levels of trauma centers, what they can and what they can't handle. The most equipped trauma centers are level 1. So they have surgeons there 24/7. They have ER physicians there 24/7. The emergency room is open 24/7, and so on. Compare that to a level 5, and they don't have surgeons there 24/7. They may be there sometimes, but they may not be. When it comes to emergency room physicians, they may be there, but they may not be on staff at that moment. Their emergency room is not open 24 hours a day. They don't have anesthesiologists there all the time. They don't do research, but they may have a trauma nurse who's there, who's constantly staffing the center. So if there's a large accident or large trauma with multiple injuries, at level 5 would definitely not be used. So the higher up in level you go, the more capable that center is to handle more serious injuries, more serious traumas, and multiple traumas at the same time. All right, now we'll talk about controlled substances. Now, this is a reference to the Controlled Substances Act of 1970. And this act established government control of certain drugs and chemicals known as controlled substances. And this is basically a classification scheme that's broken down into 5 individual levels. And the lower the number, the higher the potential for abuse and addiction. So the most powerful of these scheduled drugs is a Schedule 1 substance, because there's a very high abuse potential for these drugs. And they have no currently accepted medical use. You cannot get a Schedule 1 drug by prescription at all. There's no medical necessity for these drugs. And a Schedule 1 drug would include things like cocaine, heroin, methamphetamines. There's no legitimate medical use for those kinds of substances. The level just below that would be a Schedule 2 substance. And these can cause dependence, and there's a very high abuse potential for these substances. A good example of a Schedule 2 substance would be oxycodone, or Demerol, for example. A Schedule 3 substance, there's a lower abuse potential relative to a Schedule 1 or Schedule 2 drug. An example here, these are drugs that contain less than 15 milligrams of hydrocodone per dosage. So Tylenol with codeine, for example, would be a substance or a Schedule 3 substance. Schedule 4 drugs, a lower abuse potential than the Schedule 3. And some examples here, diazepam, which is basically Valium, alprazolam, and profoxifene. And a Schedule 5 drug, a very low potential for abuse. These are cough and cold preparations with limited quantities of narcotics. So some various over-the-counter drugs are technically Schedule 5 drugs because they have drugs that could potentially be abused, like Lyrica, like Robitussin. Now for healthcare providers that use controlled substances, there has to be a very well-defined list of policies and procedures for how to use them. Some examples that a policy would include when it comes to these kinds of substances would be how to keep them in a locked storage container, what staff has authorization to access them, what kind of protocol is there to track substance abuse and substance audits. So there must be a very well-defined set of procedures on how to handle a controlled substance in a healthcare facility setting, especially if you're dealing with Schedule 3 or Schedule 2 drugs. All right, now we'll move into the EMR, Electronic Medical Record. Now a medical record, or a chart, is a location where a provider records various aspects of diagnosis and treatment for that patient. An electronic medical record can be viewed by authorized individuals anywhere in the world, and this can be interfaced with other electronic systems. So lab reports can be updated instantly. Radiology reports can be added and updated instantly. Now, downside to the EMR is controlling access to these can be a little bit more difficult compared to a paper record. Now, something that's a little bit broader than an EMR is an electronic health record. Now, this includes demographics, billing, and all historical medical information about that patient. This helps give providers the widest possible perspective on a patient. Now, having all this information in one file gives the potential for abuse of information. All right, now we'll talk about various medical departments that you can find in a healthcare facility. The first one, ambulatory, or also known as same-day surgery. This will provide surgery on an outpatient basis, usually for very minor procedures. Behavioral health, this will provide care for mental disorders. Cardiac care units, these will treat patients requiring very specialized cardiac monitoring. Cardiovascular department, this will include advanced cardiac specialties like electrophysiology, heart failure, and heart transplantation. Dermatology, these will address skin diseases. This is usually on an outpatient basis. Ear, nose, and throat, also called otolaryngology, can also deal with facial plastic surgery or laryngology, which is a focus on the voice box, the larynx. Neuro-otology, which deals with the base of the skull and the middle and inner ear. Otology, which is the ear in general. And rhinology, which is a focus on the nose and the sinuses. The emergency room, also known as the emergency department in some locations. And these will treat patients with a life-threatening condition or patients who have an immediate need for care. And these will all be certified to a specific trauma level, either level 1 through 5. The ICU, the intensive care unit, these treat patients needing a very high level of specialized care. And this can include intensive monitoring with electronic equipment. And patients here may need feeding tubes, ventilators, and so on. Laboratory, this will provide chemical, microbial, microscopic, and other studies to help diagnose and treat an injury. Medical and surgical will care for adult patients before and after surgery. Nuclear medicine, this area will use radioactive decay of radiopharmaceuticals to help diagnose and treat disease. OBGYN, obstetrics and gynecology, this will provide care for the female reproductive system. And obstetrics focuses on the care surrounding childbirth. And some OBGYN related departments include a family birth center, labor and delivery, and the neonatal intensive unit. The OT, occupational therapy, this will care for patients recovering from injury to help regain work-related skill. They also will help people with disabilities accomplish self-care tasks. Oncology, this is a department that will focus on cancer and patients with cancer. The operating room, the department where surgical operations are performed. Ophthalmology, this will diagnose and treat various eye conditions. Pediatrics, this will specialize in the treatment of children, and the patients must be either medium or high acuity. Physical therapy, this will assist patients to regain lost range of motion. Plastic surgery provides reconstruction of the human body. A post-anesthesia care unit, this will provide care for a patient who is recovering from anesthesia. Radiology, it provides imaging equipment using X-rays and ultrasound or nuclear isotopes to diagnose an injury or a disease. Respiratory department, this will provide breathing treatments for inpatients or outpatients. This could include bronchodilators, pulmonary rehabilitation, and mechanical ventilation. A transitional or progressive care unit, this will provide transitional care between the critical care unit or the intensive care unit and the standard care unit. So the step up from CCU and ICU, but not at the level of a normal standard care unit yet. All right, now we'll talk about clinical software. Now, software is a set of instructions that helps hardware process data into information. And clinical software is used to manage data and information in a clinical environment, such as a healthcare facility. Patient tracking. Now, patient tracking software has multiple benefits. It can track the services provided to that patient. It can help manage patient demographics. It can help manage patient visit history. And can track time-specific illnesses like allergies. And many patient tracking systems are able to interface with scheduling, medical records, and laboratory software packages. When it comes to scheduling, of course, scheduling software will manage the patient's scheduling process, and some capabilities that the software would have: being able to quickly scan for open appointments, being able to track cancellations or no-shows, and being able to reschedule patients. And can also track patient visits by time of check-in and departure or check-out. The order entry, an example of an order entry would be the CPOE, the Computerized Physician Order Entry. This is where you have an electronic system that can transmit a physician's orders to other healthcare professionals. So various orders for tests, procedures, prescriptions can all be handled in a much more timely manner if it's done electronically. Some big advantages for the CPOE: the instant availability of the patient's medical history, having access to current information that helps prevent any unwanted drug interactions, statistical reports that help improve resource management, and the linking of a diagnosis to the order improves billing management. Now we'll get into billing and coding and auditing. Now, billing software helps to manage the billing process, and the software can help validate various claims that are entered, and these claims can be sent to the appropriate payer. Now, within this billing software, a set of very specific codes are used, and this is the International Statistical Classification of Diseases and Related Health Problems Code, also known as ICD-9, which has a list of over 13,000 codes that are used in billing. And the more advanced form of this is ICD-10, which is a complete revision of the diagnosis code set. And this includes over 68,000 codes. On this table we have some examples of diagnoses and what their code would be under ICD-9 and ICD-10. And for example, the last one listed here, joint derangement. Under ICD-9, that code would be 718.90. In ICD-10, the diagnosis that's equivalent to that would be joint derangement unspecified, and that code would be M24.9. Now, within this billing software, you have auditing software, and the software will include algorithms that help determine whether or not the correct CPT and ICD codes are being used. And this can use historical data for trending and analysis to predict and improve performance. All right, now we'll talk about practice management. The PMS, the practice management software, has multiple functions. It can include patient tracking, scheduling, computerized physician order entry, billing, coding, and auditing. And this type of software can be interfaced with electronic medical record systems also. All right, now we'll talk about the clinical environment. The clinical process, or the clinical environment, is a sequence of operations that must occur for the patient to be examined, diagnosed, and then treated for their condition. And this can vary by environment. But there are some common features that are found in almost all clinical environments, such as registration of the patient, consultation, examination, the CPOE, dictation or transcription, and then lastly, referrals. All right, the first step in this process would be registration. Now, a patient must be registered or admitted prior to being seen by medical staff. And while the patient is being registered, various data points are collected, including their contact information, billing information, next of kin, any current medications that they're on, and other pertinent information that may be needed. All right, after the patient is registered, the next step will be consultation. This is also known as the medical history. So questions about various pain level, location, intensity, and a brief history of activity. And this is done to determine whether or not the patient's actions are contributing to their illness. After that, you have the examination. This is the actual checking of the patient's physical status, such as taking vital signs, body temperature, blood pressure, pulse rate, respiratory rate. And the initial exam is normally performed by a nurse or another medical professional. The patient is examined in more detail by the physician after that. Our next step will be the physician order entry. This is the process of storing and transmitting orders to other healthcare providers. And these can be either handwritten or typed. They can be verbal orders, or they can be computerized, the CPOE. If they're done electronically, usually what is used is the digital signature. This is for encrypted messages similar to handwritten signatures. And this will allow for electronic transmission and storage. Our next step will be dictation or transcription. And this is used for verbal orders. So you have a centralized voice recording system that is shared among physicians in a healthcare facility. And the transcriptionist will transcribe the orders that were recorded verbally to an electronic or paper or a film format. So there's a record of what was ordered. And the last step in this process would be the referral or a consult. And the physician may send that patient to another professional for further diagnosis. And for example, a family doctor may determine that the patient has a greater need to be seen by a cardiologist. They will refer that patient to the cardiology department for more specialized treatment, more specialized attention. And after the consult, communication between the physicians or specialists is required regarding the patient's diagnosis or treatment. So everyone is on the same page regarding that patient and their care. Alright, now we'll talk about medical devices. The FDA regulates the manufacture and the distribution of medical devices in the United States. Now the definition of a medical device is something that is recognized in the official national formulary or the United States pharmacopoeia. A device is intended for the use in the diagnosis or the prevention of a disease, and it is intended to affect the structure or function of the body without chemical action. I'll now talk about some devices in particular. The first one, computerized axial tomography scanner. And when we talk about tomography, that is an imaging technique in which sections are created by a penetrating wave. And probably the best example of this would be the CAT scan or the CT scan. That's what those letters stand for, computerized axial tomography. And this is an X-ray system in which tomography is used by a computer process. Some advantages of the CAT scan: you get very high contrast resolution, much more so compared to that of a standard X-ray. And body tissues that differ in density are able to be distinguished. And that can help to lead to a faster diagnosis of a condition. Next device is EKG or ECG, Electrocardiogram. This is a two-dimensional representation of the electrical heart activity. And these readouts can be read by professionals to detect any heart disease or any heart abnormality. And EKGs are commonly transported throughout a hospital, throughout a facility, either by hand or in a cart that can be rolled from room to room. Next machine we'll talk about, the Electroencephalograph Machine. This is the machine that will help measure ionic current flows within the brain's neurons. This will measure the electrical activity within the brain. This can also be wheeled from room to room by a utility cart. And after it is used, you can have professionals who are able to read the EEG, the electroencephalograph. And this can be read to help diagnose things such as coma, epilepsy, or even brain death. Next device, a glucose monitor. It's a portable electronic device that will directly read the levels of glucose or blood sugar. And the results are available just in a matter of seconds. And this is a very commonly used tool to help diagnose diabetes mellitus, which is type 2 diabetes. The next device we'll talk about is the MRI, magnetic resonance imaging. And this device will use very strong magnetic fields to create an image of the internal body structures. And certain viewpoints can be easily obtained with this technique compared to other forms of imaging. And you get a much greater detail in the internal body structures compared to traditional imaging. And MRI machines tend to be quite large, basically the size of an entire room, and these are very complex. Alright, in this image we have the scan of a human brain when using the MRI machine, seeing the different parts of the brain here, the brainstem, spinal cord, for example. Another device we'll talk about is a portable X-ray machine. And the X-ray machine uses X-rays to cast static shadows of the internal body structures on a image sensor or on a film. Now, a standard X-ray machine tends to be quite large, around the size of a room, but you can have portable X-ray machines. And these can be transported to the patient in cases where the patient can't easily be transported from where they are to the radiology department. And these machines are portable, but tend to be quite heavy. So the next machine we'll talk about, the Positron Emission Tomography, or the PET scans. And these will use certain radiopharmaceuticals, or how they behave in different ways in different body organs. So the PET scan is actually detecting radioactive decay within the body because radioactive isotopes are used to help create a 3D image. And these scanners tend to be quite large and quite complex. But you get a very detailed imaging technique, and these are often used to help diagnose cancers within the body. So the next device we'll talk about is the ultrasound. And this machine will use high-frequency sound waves to image soft tissues within the body. But the image quality is much less detailed compared to that of an X-ray or any other imaging technique. And some common ultrasound uses would include evaluating the fetal health during a woman's pregnancy, evaluating blood flow to the brain, and the diagnosis of heart abnormalities. The next machine we'll talk about is the vascular or the nuclear stress test. Now, a cardiac stress test is used to determine the heart's response to physical stress, such as riding a stationary exercise bike or walking on a treadmill. And the vascular or nuclear stress test uses radiopharmaceuticals that emit gamma rays. And very specialized cameras will capture detailed images of blood flow in the heart, for example. Our next device we'll talk about is the vitals cuff. This will help measure standard baseline measurements: body temperature, blood pressure, pulse rate, respiratory rate. And the vitals cuff is a device that will integrate the entire vital sign measurement process, so getting multiple measurements at the same time with one device. Alright, next topic we'll talk about is medical interfaces. And there are standards that have been established for the exchange of health information, such as Health Level 7, e-prescribing, CCD, the Continuity of Care Document, the Continuity of Care Record, or CCR, the ICD-10, which is something we talked about earlier, and the CPT, the current procedural terminology. Some other standards include the SNOMED, the Systemized Nomenclature of Medicine, the NDCID, the National Drug Code ID, the Picture Archiving and Communication System, or PACS, and the Evaluation and Management Coding System, or the EM codes. Okay, that brings us to the end of chapter number 5. A quick summary of what we covered. Healthcare has a very specialized terminology and numerous acronyms. Hospitals have different medical departments that provide different types of patient care. Clinical software is used to manage and manipulate data and information in a clinical environment. The healthcare environment workflow may include registration, consultation, examination, physician order entry, dictation, transcription, and referrals or consults. Medical devices are used to diagnose and treat patients and are regulated by the FDA. There are many interfaces and standards that support information sharing between devices and systems. Right, that brings us to the end of Chapter 5's video. We will continue our video series in Healthcare Information Technology, where the next video in Chapter number 6, Document Imaging and Problem Solving.